no problem. Right, well, good morning. My name is Michelle Emerson. I'll be with you for the next 30 minutes. This is pretty much a whistle-stop tour of basically a primary survey and using an AED. It's obviously in aid of Restart Heart Day, which is like a national campaign to get people more involved. So we'll start from the basics. So you've walked in this morning and you've gone to everybody, good morning, and you walked into the building knowing you could do that. What would mean you don't walk into the building? Why can't you walk into this building? What happened? What would need to happen for you not to walk into this building? Fire. Now, did you walk in and go checking for danger? Or did you just get out of your car and walk casually into the room knowing you could do it? You did that, didn't you? Primary survey really, good morning. Primary survey really is no different. We just have to exaggerate it a little bit, okay? So we're going to use an acronym called Danger Response, or Dr. ABC. First thing we're going to do is check the area for danger. Okay, going to make sure it's nice and safe. If it's not, we're not going to approach, but the minimal thing we're going to do is call 999. We might need a fire brigade, we might need mountain rescue, we might need the Coast Guard, or we might just need the paramedics. So we're going to call them if we need to, okay? But if I can't get into the building, I'm going to call them first. Okay, my safety is paramount. Next thing we're going to do is try and elicit a response from my young man here. So how am I going to do that? Well, how did you get a response from people this morning? Talking to them, perfect. Now, if I walk in, okay, and he's already alert, I'm going to have a good chat with him. Okay, find out what's gone on, find out why he's on the floor. If he's having a cheeky sleep, then probably get him go back to work. Not that you do that, but a little bit embarrassing. I've already called help already. Okay, so we're going to have a little chat. Now, he's not responsive to me, so now I'm going to talk to him. Okay, come down here. I'm going to give him some commands. I'm going to talk to him. Can you open your eyes? And I'm going to repeat it a couple of times. Now, at this point, I can either squeeze the shoulder or put pressure or tap it on there. What I'm not going to do is move his body. Okay? Now, if I look at my little board there, it's all on there. We didn't get a response from him, so now I'm going to do the next thing, which is create an airway. So I'm going to create an airway. To do that, I'm going to do a head tilt chin lift. Now, if I created an airway and did that, why would that not work? Close his mouth. So if I now go and listen, I'm going to hear nothing. I'm guaranteed nothing. So I need to do my head tilt, which is where this is here, 2 fingers under there. I'm going to lift that up there so I can actually make the mouth a little bit bigger, but also make sure the mouth is open. I then get my ear all the way down here. It's got to be this close so I can hear anything. Look down the casualty's chest and see if it's moving. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. How many times should he breathe in those 10 seconds? Do you think? How many times do you breathe in 10 seconds? Probably 2 or 3. It's not that much. Now, if you see anything other than 2 and 3, it's unlikely to be fast. It's more likely to be slower. If you see less than that, we're still going to do CPR. Purely because it will not be enough to sustain their life if they're allowed to carry on doing their less than 2, 3 in the 10 seconds. So they're not breathing normally. Can I save him? On my own? It's really unlikely, really unlikely. The stats tell us it's about 4 to 8%. Out of hospital cardiac arrest, that's your chances, that's his chance of survival. It is. Well, but I don't know. Luckily, I've never done it. I've done everything else. I'm very lucky not to have to do it. But I can't do this on my own. Who do I need to call? Yeah, by what number? On the board, guys, we've got 3 numbers, 999, 112, and 911. They will all go to the same place. Okay? We've been brought up on American TV, so kids actually believe 911 works. So they've bought the number, they've transferred it, and it does work now in this country. Okay? 112, yeah, because it's everywhere. 112, again, it is, but it's also for this country as well. It's not a locational finder either. It's just purely going to get the same place. So 999, 112, and 911. Okay? We'll all sort of get you to the same place. So I'm going to have to give them some key information. Now, we have an order. So if I ring up 999 now and I tell them I've got someone who's broken their leg, I'm really way down that list because they're breathing, they're conscious, they're not really a priority. So we actually have an order. So the thing in this arena, in this industry, okay, your biggest priority is not breathing. Nothing comes above that. So our not breathing casualty comes first. Underneath that, we have our bleeding casualty, Underneath that, we have our burns or breaks, depending on how bad the burn or the break is, and any other underlying condition. So if you don't mention they're not breathing, you've dropped down on this straight away. But they will speak to you on the phone. They've got a little script, so I'll tell you what to do. So we're going to say they're not breathing. I've already called 999, and I need now an AED. I'll talk about this in a minute. Okay, so I need to ask for an AED. So I've got them coming. If I need to, I can activate my speaker function on my phone. Okay, but I'm hoping to get one of you guys to go and get the ambulance for me. I cannot start CPR until I know the ambulance has been called or is being called. So I need to get off my backside, shoulder over wrist, put my hand centre of the chest here, insert my fingers, and I'm going to push down at a rate of 100 to 120 beats per minute. Now, very luckily, these mannequins click, so you've got to hear a click. Your real human won't click. Okay, so don't keep going till they do. Okay, it has been known. So we're going to keep doing that. Now, normally we do 30, and then we go to 2 breaths. You're not doing the breaths today, because when you pick up the phone and they talk you through it all, they will say to you categorically, no breaths. And this is their rationale. The reason being is, don't get me wrong, 30 to 2 is the gold standard. Okay, and it may have a better outcome, but the chance of you getting a seal is really slim because of facial hair, facial types, all the rest of it. The chance of you wanting to do it is even slimmer because of they are likely to be sick, they're likely to vomit, you might find there's blood there, you might find they've got a broken jaw, or you might find you just don't want to. So what they've said is when you ring up 999, they know that we can make quite a lot of leeway with doing this here. Okay? So the idea is we're going to concentrate on doing compressions only CPR. So we're doing compressions only CPR, we're going to go 100, 200, 300, and then get somebody else in to take over on a regular basis. Okay, so once we've done that, keep doing it. There's no gap. There's no gap. So get a load of friends together, and we'll just swap over. How long do you think I can do CPR for before I start getting tired or before I lose my competency? How many minutes do you reckon I can go for? 2 minutes, and then I start losing about 30% competency, and nobody here, me included, starts at 100%. So we need you to swap over on a regular basis. Now they reckon at 2 minutes, that's when you start getting tired. So do about 100 compressions, then change over to somebody else. That's the easy way of doing it. If you don't get tired, you don't need downtime. You'll struggle anyway afterwards because the aftermath that causes the biggest problems. So you're going to do 100 compressions, talk it over to somebody, so you can say, right, are you ready to take over from me? So as soon as you come off, they're going to come straight back on. They're taking off my hands, then they'll go straight back on. So there's limited gaps in the body itself. Okay? Now my AED's turned up. Now luckily for you, this is the one that you have in your lab downstairs and in your kitchen here. Now if AED turns up, we're going to get it on ASAP. This now takes priority over everything else because this is the thing that's potentially going to help them. Okay. Now how does an AED work? Anybody know? How does an AED work? What does it do to the heart? Yeah, sends electric. Yeah, it sends some joules over there. Yep. What does it do to the heart though? Stops it, starts it, restarts it. What does it do? Actually stops it. Stops it. So this is your heart. Your heart has actually got 2 nodes in it and their electrical circuitry. The first node is the one that actually sort of gets the message from the brain. It just works automatically. That's your pacemaker. The one underneath works in response and it goes, oh, I've heard from it, so I might as well work. So it does this. So it goes bum bum. Or basically goes, hi, hello, hi, hello. Does that all day long. If you run around like an idiot, get really stressed or get really worked up, it'll work quicker. If you relax, it'll go a lot slower. Okay, but fundamentally, this gets messages from the brain. This actually gets messages from the other node. Now we've got a problem inside the heart itself, and the messaging gets a little bit crazy. This one still works. This one goes, well, I haven't heard for a little while. I know I need to work, so I'd better work. So all of a sudden we get this. No blood's going out. There's no blood moving. So it's gone into what's called chaos. Now these can sort of pick the chaos up. So the idea is we come along one of these, when it's picked there's chaos there, it goes bang, and it goes back to normal. Okay, might do a little fuddly bit first of all, but it pretty much go back to normal. Okay, and that's pretty much how they work. Now some of them won't shock straight away. They might say no shock available, and that's okay. So I'm going to go out and actually make a quick phone call. I said I'll make a phone call 1:15. So I'm going to come back in, and because you're all really well behaved, you're not going to talk. Or are you? You're going to have a little chat, aren't you? Now I come in, and the noise level's quite high. So I don't want to shout over you. I don't really want to shout at you because you look like nice people. So what I'm going to do instead is I'm going to wait for a lull in the conversation. Right, eyes forward. No, didn't hear me. Okay, I'll wait for the lull. Right, eyes forward. And so, oh, she's back. We'll pay attention. That's all this does. It looks for an undercurrent of rhythm in the heart itself. It's gone to chaos. So if it doesn't shock first two or three times or for a little while, it's not broken. It just hasn't found a shockable rhythm. It won't waste its time. What it will do is analyse every 2 minutes. So you'll be doing this for 2 minutes before it analyses again. Okay. Now, as soon as it comes on, I'll put it just there so you can see it. As soon as it turns up, it goes on straight away. Now takes priority. Now, if it's 2 people, which hopefully there will be, someone bringing it, I'm going to stay on the chest as long as possible. But as you approach, if I can, I'm going to take the clothes off because I don't really want to put the pads directly onto clothes. It's got to go directly onto skin. Okay? Now, this one doesn't actually start from an experience point of view. It starts from a layman's point of view. So it says open here, so you're going to take this off. If I turn it on now, look at the instructions it gives you.
Unit okay. Stay calm. Check responsiveness.
Done that.
Call for help.
Done that.
Open airway.
Done that. Now, we've got something called the chain of survival. This is a system that allows us to get the best outcome for our casualty. So the first link, and there are 4 in the chain of survival, the first link is recognising someone's at risk of cardiac arrest and dialing 999. That's your first link. Second link is going to be doing CPR. Third link is getting this. Now, out of hospital cardiac arrest, depends on what stats you read, and they do vary slightly, anywhere between 4 and 8%. Out of hospital cardiac arrest is anywhere between 4 and 8%. Now, if we bring this into play and we get it on and it shocks within 3 to 5 minutes, it goes up to 70%, 50 to 70%. So we need this on. So this has to take priority. So I'm here doing this. Now, it turns up, that now takes priority. So if I have to come off for the pads to go on, then I come off. But I go on every opportunity because we need the oxygenated blood pumping around to the brain so we feed all the vital organs as well. Now, you've got this one. This one's a bit of a different one because what it does is it actually has pads that are joined together. Now, the beauty is, let me take that for a minute. This here can detect how fast you're going, how slow you're going, how deep you're going. And it will tell you, push harder or good compressions. Okay, so it's got a nice little bit on there. So you put that center. These will naturally go top left. Well, that's probably not quite in the right place because the pads have to send a message through my heart. If that stays on the top, my heart isn't anywhere near the front of my body. It's sort of in the middle. So I have to give this no choice. So if I pull this off, because it's got Velcro, and put it here, the straight line now is directly through my heart. Does that make sense? So it has to be at the side. It can't be at the front here. Even if it goes here, you've potentially going to miss the heart. Has to be at the side. Now, the pictures are one-dimensional, so they might give you a bit of a false sense of where they go, but they definitely go across the side here. Okay? Now, once both pads are on, this has the ability to bypass all the instructions. So let's just see, without me going too quickly, how fast I can do it.
Unit okay. Stay calm. Check responsiveness. Call for help. Open airway.
How quick was that? And what it will do is,
Don't touch patient.
it bypasses all the instructions. It says stand clear. So we're going to stand clear. I'm going to move back a little bit, but not too much. I don't need to. No one else is touching it.
Shock advised.
Can you all see?
Don't touch patient. Press flashing shock button.
Can you all see? Yep. So I'm going to tell you when I'm shocking it. So about to shock.
Shock delivered. Start CPR.
Now this one will start off slowly. This one starts off slowly so that it allows you as a layperson to to get quicker. If you know what you're doing, then you can just start straight away. Okay? So, can you kill somebody with a defibrillator? No. It's your best friend, basically. No, not at all. Well, don't drop it on the head. Okay? That might give you a bit of harm. Now, when we look at doing the child and the infant, we've got a bit of a different setup because we believe a child and infant is breathing. Now, child is going to be one hand, so all the stuff stays the same, all of that stays the same, but we do one hand. Now, ideally, we do 5 breaths, but we're not going to bother because we're not doing the breathing today. We're going to straight on the chest, arm, shoulder over wrist here, push down, third the body. As soon as you can't do it, you go to 2 hands. So my child over there is roughly 1 to 18. So an 18-year-old or 17-year-old looks like him. I'm not going to do 2 hands. I'm not going to do 1 hand. I'll do 2. Your infant, we're going to do a little bit of different check now. They do have the ability to respond because they can look up and they can look towards you. What we are going to do is tickle their feet. So we tickle their feet here. We find the toes will curl over and you'll get a reaction. They don't like it. They really hate it. Now, I need to find a hard surface. So the floor or a table is the best place to go. And we're not going to do a head tilt chin lift. All we're going to do is just tilt the head a little bit. Still the same thing. I'm going to look down the casualty for breathing. I'm going to make sure that they're breathing, but they're going to breathe a lot quicker than this. So what we're going to do is look for uniformity and continuity of breathing. So we look down here, keep the head at a nice flat angle, look down here for breathing continuously. When we don't get a breath, again, priority is going to be breathing. If you can do it, great, but if not, 2 fingers here, third the body as a child, push down, and you're going to keep going. Okay? Any questions? The defibrillator pads on our paediatrics will always go front and back because they've got a tiny little side, and you'll find that will end up curling over here. You won't get the pads reaction, so it'll go front and back on child and infant. Okay? Right, what you're going to do is there's some defibrillators set up for you. Have a go on the adult. You only have time to have a go on one. As long as you have a go and see how the defibs put the pads go on, that's fine. If you put yourself into groups of 3, so there'll be a 3, a 3, a 3, and a 3, or whatever, 3, 3, 3, and a 2, that's fine. And then have a go. Okay, off you go.